This is an experience of a young man who had his first filling ever done. He's about 14 years old and has never had an injection, never had any drilling. He was very apprehensive. The air abrasion was superior in helping him through this difficulty.
Okay, this morning was the first time you've ever had a filling done. So why don't you tell me your experience? What
I
happened?
thought it would be a lot worse than it was. There was barely any discomfort. It was just like some powder just rubbing against my teeth. My gums just got a little, uh, like, itchy a little bit, but otherwise it was a lot better than I thought it would be.
Okay. Well, you were a fabulous patient. You made it tremendously easy for me. So thank you so much.
Thank you.
This is what the tooth looked like beforehand. 14-year-old young man, and he was going through braces. You can see this is the second molar, and very difficult to clean. And he ended up getting decay back there. And we use the air abrasion system to gently remove the enamel. Now, it's possible to use a small drill bit in order to do this, but by the nature of decay being past the enamel, which was true in this case, which was diagnosed with a laser, you're going to feel pain, and then you have to numb the tooth up and have all the different discomfort with that before and after. And with the air abrasion, you're able to get into the little grooves, as you can see, and clean everything up, and without having any significant pain. He mentioned in the little testimonial that he felt like a little itching sensation, and that's truly what the air abrasion does. If you used a fissurotomy burr, that would be painful, and the patient would continue. Now you can see the small little grooves that we've been able to maintain or see in the tooth there, as we're using aluminum oxide to remove the enamel and the area of decay and a little bit of the next tooth structure called dentin. The nice thing about this particular system is there's less powder, so it allows you to be able to see, and the situation being that you can also use a helium gas so that there isn't as much powder going through as well, and the ability to see through the mirror, which I think is really a plus, because when you're looking at a lower molar and you use the mirror, you're able to see directly as to every place that you want to remove, as opposed to an angled shot. And this is me just finishing up, making sure that everything's nice and clean, and cleaning that out so that there's no remaining bacteria that would continue to cause a problem. So we have everything cleaned out, and as you can see, those are really small grooves, and we'll put some flowable when we bond it in to get into some of those little nooks and crannies, and then we'll place the normal composite on it as well, more for strength, and I actually add a little bit beyond the groove to make it a little bit thicker, and when it's bonded in place, it has a nice bond to the enamel. Here I am condensing it into the area, making sure that that's nice and firm. and there's already been some flowable placed underneath that. This little burnisher just to smooth out the area, and after that we'll come back and use a light to cure it, and then when that's done you can see that the filling is kind of in place, but I liked to finish it, and that's what this little white stone is, to remove the excess composite and make that be nice and smooth up in front of it. And then we'll come back and use polishers. I use a double polishing system that polishes that up quite nicely, and makes it so that plaque and tartar doesn't adhere to it as readily. We check the occlusion, and because they are in ortho, it's not touching the filling, but when the time comes, it's very easy to modify the filling.